Dr. Quinn, thank you for being with us.
Hey, thank you for having me.
Explain this concept of long COVID for us. Is it something that's common with the Omicron strain?
Not necessarily the Omicron strain, more so the earlier strains, because right now the CDC is actually recognizing it as a diagnosis of someone that contracted coronavirus and still having symptoms about 4 weeks or more later. So this is typically from the earlier strains, because remember the Omicron strain is pretty recent. But what I really want to convey is it's now being recognized, it's now being taken seriously, and that's very relieving for a lot of patients that have been to a lot of different medical providers, including specialists, and in a lot of cases, they've in the past been told it's all in your head, but now it's being taken seriously, and treatments, research, a lot of resources are being allocated to try to help these patients that have been suffering for so long.
And what are the symptoms of this? Are they similar symptoms to the people who the same symptoms that they had when they had COVID?
Not necessarily. I mean, it varies, and that's what makes it so difficult to pinpoint. It's a very vague diagnosis. It's almost a diagnosis of exclusion, meaning that we evaluated a lot of different things and we can't come up with a definite diagnosis, and this is the diagnosis that we have. But a lot of these patients, they present with fatigue. This is very common. When you listen to reports, the patients will tell you that they're just tired all the time. And maybe when they walk up the hall, they'll even get short of breath and their heart will beat very rapidly. It's very difficult. Also, a lot of patients are complaining of what's called brain fog. They just can't concentrate like they used to. They're not sharp anymore. And then some people even start to develop anxiety and depression. So it's something that really should be taken seriously, because a lot of people are unable to maintain their occupations, and some people are filing for disability. So it's something that we really need to pay a lot of attention to.
Are people with long COVID contagious?
There are no reports indicating that these individuals are contagious, and that's encouraging in reference to long haulers, meaning that these are individuals that contracted coronavirus, they recovered from an active infection, but they have these lingering symptoms, but there are no reports of any contagiousness of these individuals, so that is encouraging.
How common is this phenomenon with people who are fully vaccinated? Is there anything there?
You know, I am so glad you brought that up, because I've looked at a lot of research on this, and overwhelmingly it's being reported that people that got vaccinated, even if they had what's called the breakthrough infection, they contracted COVID after they got vaccinated, they tended to recover more quickly with much less severe of a disease process and much less likely of a chance of developing this long COVID syndrome. So if people that have been vaccinated, they have a better chance, but people that were not vaccinated got very sick, went into the hospital on ventilators. It's much more common in this population, which is just another reason why everyone needs to get vaccinated.
All right, absolutely. All right, Dr. Quinn, thank you so much for being with us as always.
Hey, thank you for having me.